Thank you for joining us for Healthline 3. I'm Jade Balexa. Dr. Donald Sorrells of Willis Knighton Pediatric Surgical Associates is here to talk about a special topic: kids, things they swallow or aspirate. And this happens when kids put things in their mouths that don't belong there. Dr. Sorrells, thank you so much for being here today.
Thank you. Thank you for having us.
Absolutely. Well, tell me, how commonly do you see kids in the emergency room for this?
So we see kids a lot more frequently than you would think, and at Willis Knighton South we draw from essentially the whole northern Louisiana area. That hospital system is equipped with pediatric anesthesiologists to take care of those kids. Plus we have specialized equipment for the different ages. You know, we would use certain instruments for very small infants versus teenagers. So everything is sized, and we have a really good staff and a really good system.
Mm-hmm. What have you seen here lately in the emergency room? This past week you were talking about some different cases you had.
Right. So this past week we had a little girl who aspirated half of a peanut. So the peanut got into her right mainstem bronchus. The oil on the peanut, the oil on the nut itself, is actually irritating to the respiratory mucosa, and that if it's left there, that can cause pneumonia, cause a lot of chronic inflammation in the lung, so it needs to be removed. Then we had another 14-year-old who aspirated a push pin, thumbtack, and that was in the airway as well. And then we had a third child in the past 5 days that had swallowed several magnets. And the problem with magnets is if you just swallow one, the child usually will just pass the magnet, pass out. But if you swallow two, then the two magnets can be in two different loops of bowel or two different parts of the intestine, and they'll actually come together inside the abdomen and cause a fistula, and frequently you'll get a bowel obstruction. So that child had to have an operation to have that fixed.
Wow, that sounds like that could be dangerous if you don't remove them.
Right, it's very dangerous.
Uh-huh. Well, tell us, what are the symptoms that children can often have when they swallow something they're not supposed to?
So the older children can tell you, the 3, 4, 5 and older, they'll tell you if they have something stuck in their throat. They can tell you what they swallowed. What's harder to figure out is if you have, an infant or a 1-year-old or 2-year-old that's, not talking. Their symptoms, they tend to stop eating. If they've had the ingestion for a long time and it's causing an injury to the esophagus, they may have fever. So, frequently what I see is, moms will bring the child in, or the parent will bring the child in, and they're not sure exactly what's wrong, but their radar is saying that something's wrong. The child's not acting right, not eating, not behaving normally, and then once they come to the emergency room, they do their evaluation, and then a lot of times they're going to get their x-rays, and they'll see those objects on the x-ray, because they're not all of them, but a lot of them are metal, and so it'll show up. But it's just important to kind of recognize, depending on the child, kind of what's going on.
Talk to me about what we're seeing on the screen here, Doctor.
So this is a picture of a young child, an infant, who had a disc battery, which those disc batteries are in your car's key fob or maybe in a remote, but everybody has those kind of in their household. But the baby swallowed this, and you can see the disc battery right there at the upper chest. And then on the film on the right, you see it kind of on its side. And the problem with that is that disc battery in the esophagus will actually discharge and cause an injury, an electrical injury to the esophagus. And that injury can occur within 2 hours of that battery being in place.
Wow.
Yeah, and I think the next picture may show the endoscopy. Okay, so that's the disc battery,
Oh.
and there's some tissue that's attached to the battery. That's pieces of esophagus, the lining of the esophagus. So those batteries are dangerous, and they should be kept out of reach of especially infants and young children's reach, because they'll swallow them or try to swallow them. And I think the next picture shows, yeah, that's an endoscopy picture. So the picture that's in the upper left, which just shows kind of pink tissue, that's normal tissue. And then if you see the other pictures, the other 3 pictures, that shows kind of that gray or darkened areas, that's actually injury to the esophagus itself from that disc battery. So it can be severe enough that it will actually cause what they call mediastinitis, which is essentially an infection in the center of the chest. And it's possible, if it's not treated soon enough, the infant or the child could die from that. So those disc batteries are, they're an important part of our modern life, but you also need to be aware that for kids, it can be dangerous.
So is there anything a parent can do if they're en route to the emergency room?
So yes, recently what the recommendation is, and this is kind of interesting, they recommend using honey. So you can take a tablespoon of honey and give it to the child every 10 minutes, and that honey will actually coat the battery, and it will decrease the amount of injury to the esophagus until they can get to definitive care, and somebody like me or another surgeon can remove the battery from the esophagus.
Because it looked like in that one x-ray picture that disc battery was just taking up the whole space of the esophagus, like blocking it.
Right. It relative to that infant size, that is a fairly large object. But kids, they swallow stuff. They swallow just the oddest things, and you just have to be aware that can happen. What's hard for some parents is sometimes they see it, they witness the child doing it, and then they know. But then other times they don't witness it because it happens so fast. And the only symptom that they have is that the child's just not eating, he's just drooling or not acting right, or and they just have to have a low threshold to go ahead and take them to the pediatrician or take them to the emergency room to get them evaluated and get an x-ray, get it checked.
And tell us, what are some other dangerous objects to children?
So we talked about batteries, not batteries, we talked about batteries, but magnets. So magnets, you find those in toys sometimes. You find them in the grocery store, sometimes out in the kitchen in the shop or whatever. But if you swallow more than one battery, or a child swallows more than one battery, those batteries can kind of come together and bring different loops of intestine together, and then that will cause, because once it sticks together, it'll stay together. It'll cause a fistula, and usually cause a bowel obstruction. It may perforate, cause sepsis. So yeah, batteries, more than one battery is bad for a child to ingest. Other objects that we see ingested, obviously caustic ingestions, things like oven cleaners, detergents, those should be kept out of a child's reach. They can cause a lot of injury to the esophagus, or to the mouth and the oral cavity.
How often do you see children with the food bolus stuck in the esophagus?
So we see that probably at least a couple times a month. The interesting thing is that in the past we would go in and identify the food bolus that's in the esophagus, and there's a picture of a food bolus on the right, and you can see sort of a contrast study over on the left. But we would push that into the stomach, because once it gets to the stomach, it's, it'll get digested and pass through. But a lot of these kids, what we've found is that a lot of these kids will actually have a certain type of inflammation of the esophagus. So their esophagus just doesn't work as well as other kids' esophagus. So they call that eosinophilic esophagitis. So if we find these kids that have a food bolus, we can push it into the stomach, and then either at the time that we do that or later on, we can biopsy the esophagus. And if they have eosinophilic esophagitis, we can treat them with steroids, and that will usually decrease the chance that will happen again.
Mm-hmm. What are the implications of this?
Usually a food bolus, because they come in because they're usually older, so they know that something's stuck in their esophagus. Usually the implications, there aren't any long-term implications. They're treated with the steroids for a while, and then usually it resolves, and they're not chronically on the orally ingested steroids. But by identifying the underlying problem and treating it, you're hopefully avoiding them having another food bolus getting stuck in the esophagus, because the esophagus just has poor motility.
Mm-hmm.
So.
And when kids aspirate a foreign body, what are the symptoms there? How do you know?
So they can do a lot of different things when they aspirate a foreign body. I've had infants who've aspirated some foreign bodies, and we'll show you some pictures of those, that they actually turn blue because that foreign body gets stuck high up in the airway, and that's very life-threatening. That's an emergency. They have to go to the operating room immediately to have that removed, and it has to be removed safely, which takes a little bit of expertise to kind of get that taken care of. So this picture, this is a bolt. There you can see the little small bolt on the x-ray, and then you can see the end of the bolt that's in the right main stem bronchus in the middle picture, and then the picture up on the far corner just shows the bronchus after we remove the bolt. And then I've got a little picture of the bolt over on the side there. These objects, I think sometimes kids play with things in their mouth. Maybe they get scared and they gasp, and when they get scared and they gasp, or something happens or whatever, that object kind of gets in the right spot, and then it gets just kind of sucked down into the airway, and you've got this foreign body that's down in the lung. I think the next picture, maybe the next picture. Yeah, so these are some of the interesting objects that I've removed from
oh my gosh.
kids' airways. The middle picture is probably the oddest thing that I've ever removed from a child's airway. That's actually a wasp.
It's a wasp?
It's a wasp. So that wasp, I believe, came from a nest, because it was all kind of curled up or whatever. But this child was about 15 months old, came into the emergency room, was turning blue, was coughing. We got a chest x-ray real quick, and then took the child to the operating room. I stuck a scope in, and when I looked in that bronchus, I don't have pictures of this, but when I looked in at that bronchus, I could see the insect's head looking back at me. Yeah, it was very, very odd. And then, we have different instruments to remove kind of different objects because we see it enough. And we removed it, and I was actually shocked that in that 15-month-old, there was essentially a fully formed wasp that was just kind of laying in there. The picture on the far side is an airsoft pellet, one of those little BBs. And then the other picture in the dish is like a little bead from a bracelet. But I remember one case, this was a long time ago, you have those Bic pens, just a standard crystal clear Bic pen, and you have the cap on the top of it. Well, if you notice, that cap has a hole at the top, right? It's which you cap it, but it doesn't really completely seal the pen. Well, I had this was like a 13-year-old girl. She would chew on the pen, and her dad was on her. He kept telling her to quit doing that, and she of course didn't quit doing that. And one of her friends scared her, and she aspirated the cap of that pin down into her lung. Okay.
Oh,
so
my
when she
goodness.
so when she came into the emergency room, you could listen to her lung on that side where the cap was, and you could hear kind of a whistling of the air going through that cap. But she wasn't really worried about me taking her to the operating room. What she was worried about was her dad finding out.
Because he told her
Right,
not
he
to
told her
do
not
it.
to.
He
And
told her to quit doing that.
I told her I couldn't help her with that. I could get the pin top out, but I can't help her with the dad's going to find out.
Uh-huh.
But anyway.
How do you do that operation? How did you get that out? How did you get that pin cap out?
So we have about 5 or 6 different sets, and they're different size instruments. But it's a rigid metal tube, and then it has a long optical lens, and then we have I don't know, probably 10 or 15 different graspers. So there's actually a grasper for peanuts specifically, because a peanut, if you grab the nut, with I don't know, something that will crush it, then you drop all these little pieces of peanut down into the lung, and you'd have all that inflammation. So we have a special cupped grasper just for peanuts. We have a grasper for coins. We have a grasper for things that are hard to grab, like a marble, like a hard ball. We have these little spiral baskets that will actually come out. You can kind of look in endoscopically, and the spiral basket will come out and grab the marble or the ball to kind of pull it out. So it's a real, it's a very cool set of instruments to kind of get that out safely. And at Willis Knighton South, we have every single one of those sets for every single age. We have 2 sets for each age, because obviously if you're in a child's airway and you're trying to pull something out, and maybe something is not working or doesn't work, you don't have time for them to clean it. They just have the other set. We break open the other set, and we keep going, because you really, a lot of times you don't have an excess of time. You have a short amount of time to get that out and get it out safely.
Thank goodness for tools and doctors like you, Dr. Sorrells. Okay, we have Brenda on the line right now. Good afternoon to you, Brenda. What is your question?
Well, I caught this episode just a few minutes ago, so I really didn't hear all of what he was talking about. So is this just for children, or does this apply for adults too? 'Cause I have it sometimes with the Coke tabs, these little metal aluminum Coke tabs. When you open a Coke can, sometimes it'll fall down inside, and I have been known to drink with it, and then sometimes my grandkids will come behind me and they'll grab it and then they'll drink it. What would happen if they drink it and they swallow it?
So that's an excellent question. Thanks for your question. So I am a pediatric surgeon, so I deal mainly with babies and kids, but this does happen with adults as well. Thankfully with adults, your esophagus and everything else is bigger. So if you swallow something, it more than likely is just going to pass, through your intestinal system and out. But if you have symptoms, if you're having abdominal pain or vomiting, or you're having difficulty swallowing, then that's something that would need to be evaluated. Adults do, just like kids, sometimes aspirate things into their airway, and those have to be removed as well. Usually with adults, they'll have a lot of coughing. They'll notice that they have irritation in their chest, and they usually know that they aspirated something. I mean, usually. So you'd want to seek medical attention if that happened. But it happens with adults as well. Just probably not as common of an issue as with children, because they're small and kind of like Jade had mentioned, the objects are relative to their size are bigger and they tend to get stuck.
Thank you, Brenda, for that. We appreciate you. Yeah, and you think about children and babies, the systems are just more delicate, and children are growing, and like you said, adults, I guess, we're older and our systems can kind of push everything out.
Right. I think that if we knew how many objects kids and older kids and even adults ingest, the denominator of that number is probably very, very large. Mm-hmm. The number that surgeons actually see, or that we see, is just a small portion of that, where the child has symptoms, or maybe because of the object that they ingested, it's dangerous, like the disc battery or like magnets. So yeah, I think there's probably a lot of ingestions that happen that just sort of resolve themselves.
Wow, that's interesting to think. I mean, what advice would you give parents at home to maybe keep these items out of kids' mouths?
So I think just realizing that, especially with an infant, a 1-year-old, 1.5-year-old, 2-year-old, that if it's laying on the cabinet, if it's laying on the coffee table, if it's somewhere within their reach, they're extremely quick, and they will grab it and they will put it in their mouth. So if you just do a cursory kind of run through your house, make sure that those objects are not, they're put up, they're in a cabinet or high enough that the child can't get to them, because obviously we would prefer not to have to operate on anybody's child for any of these ingestions, but I think it's just something that you may not think about until it happens, and certainly if you have any magnets, I would either put them away, or if you don't need them, throw them away. Because I can, those we don't really have, other than operating on a child that has ingested magnets that have kind of caused a bowel obstruction. We don't have any other way to get that resolved. So that's a particularly dire situation for the baby.
Have you ever had an object you weren't able to remove?
So I have. If you have something that's really, really small, and it gets, they aspirate it into the airway, and then you put in the scope and you go as far down as you can into the airway, sometimes that object can be beyond what you can see. So it's just too far out into the little small airways. And if that's the case, then usually, depending on the object, the body will kind of wall it off or scar it in, and it's usually harmless or not going to cause a problem. I did have one child, this has been a number of years ago. Again, this was a push pin. The child aspirated a push pin into the bronchus. He didn't tell anybody because he thought he would get in trouble. And then 2 or 3 years later, after the kid had had several bouts of pneumonia and infection in the lung, somebody realized, because the part of the push pin, has a plastic cap and then it just has the little metal sliver. They finally, on an X-ray, saw that little metal sliver of the push pin portion of it, and we went in to do the bronchoscopy and to look for it and to pull it out, and that push pin had completely incorporated into the wall of the bronchus.
Wow.
So it was no longer, you were no longer able to grasp it or remove it through the airway endoscopically. Because that child had recurrent infections, we actually had to go through the chest. So we had to go into the chest and go from the outside, make an incision into the bronchus and physically remove it, and then stitch up the bronchus.
But the push pin had actually caused infections?
Yes, because the push pin itself obstructs the bronchus. So it's kind of a foreign body or something physical that just sort of blocks the airway, the passages, and that will cause a backup of mucus, and that mucus is a nidus for bacteria to infect it, and then they have just kind of recurrent infections. And those, until it kind of gets embedded into the wall of the bronchus, those objects will kind of move when you cough. So they'll clear a little bit of the mucus. You treat them with antibiotics, the lung will clear up, and then they'll get infected again, and it's just kind of back and forth. But yeah, occasionally we have something that we can't remove, and depending on what it is, sometimes we just leave it. If it's really, really small and it's really, really distal, if it's in one of the main airways and it's embedded in the airway, then we may have to surgically go after it.
Wow, that's just so incredible. And so, I mean, it's really important that the children speak up if they swallow something. I mean, if you're an older child, for sure.
Right. They need to let the parent know, and typically, not that a teenager's less honest, but the ones that are going to hide it tend to be the teenagers because they don't want to get in trouble. Usually the younger kids will let mom know or let dad know or let somebody know that they've swallowed something or they've ingested something or they're coughing because of something. But yeah, they need to let them know. Yeah, because the sooner we can intervene and do something, the less inflammation in the lung, the less infection in the lung, or like if you're talking about the disc battery in the esophagus, the less injury to the esophagus. So yeah, the sooner the better.
Okay, so tell us, you showed us some of the pictures of the different items you removed. What would you say is the most interesting?
Well, the wasp was probably the most surprising. I've taken out over the years the cap from a Bic pen. I've taken out a Hot Wheel, the wheel off a Hot Wheels car. I've taken that out of the airway. Several BBs. I've had a lot of coins in the esophagus, everything from quarters to dimes to pennies. Yeah, that's probably the most interesting is probably the wasp, because I was not expecting that.
What would you say to a parent who notices that their child has swallowed something and they're just in panic mode? How would you calm them down?
So I think if they know that their child has ingested something, like a caustic ingestion or like a disc battery or even a magnet, they need to go to the emergency room, have that evaluated, and they'll get an X-ray. They'll assess the child, and there's nothing that the parent did wrong. I mean, they didn't put it in the child's mouth, and they didn't, that's what kids do. They put stuff in their mouth, they aspirate. That's just what kids do. And so it's not their fault. They just need to, go ahead and expeditiously get to the emergency room, get that evaluated, make sure it's not a problem. And then if it is an issue, then we have the tools to take care of it, and we'll take care of it.
Absolutely. How can people contact you if they have questions?
So they can call our office, which is 318-212-5880. They can also call Willis Knight and South, and we're always available.
All right, that sounds good. Well, thank you for this. This was very informative. A lot of things I didn't know about children and swallowing different items is really eye-opening, and I know it happens a lot. And that's why you're here. So thank goodness for you and the work you do. I appreciate you, Dr. Sorrells.
Thank you, Jade.
Thank you. And thank you all for joining us for Healthline 3. Join us tomorrow for another edition.